All right, let's get started. Welcome everyone. I'm so grateful you chose to spend your hour learning about how to normalize mood changes and for us to discuss why it happens and how to respond. This is a really sort of exciting component of our webinar series. So very excited to share this information with you all. To introduce myself, I'm Lindsay Buvel. I'm a clinical trainer and full-time therapist here at Meru. I've been with the company for about a year and 10 months. It'll be 2 years at the end of July, which is just so exciting. It feels like, truly the time has flown by. So largely my role is to help support training efforts for new therapists, support therapists in learning how to engage in digital asynchronous care. Certainly how we can best support our participants, how we can utilize a variety of different interventions to really support people. And then just help the team even with just program development, content development, so we can continue improving our product. Prior to Meru, I've worked in a variety of healthcare settings. So I've worked, and I originally was based in Chicago, stopped over in Charleston for a bit, and now I'm right outside of Philadelphia. So I've worked in inpatient settings, partial hospitalizations, intensive outpatient programs. And then most recently, prior to coming to Meru, was in more of a private practice outpatient setting, always primarily treating mood anxiety disorders and binge eating disorder. Before we jump in today, so we do have a mindfulness exercise planned. We always like to, in true fashion to Meru Health, we do always want to incorporate a mindfulness component to just support everyone in grounding themselves, feeling centered in order to most effectively engage with our material. But before we do that, I did just want to take a brief moment and just hold space and just sort of acknowledge. I think there's been a lot of really devastating events happening. Most notably yesterday, I think, our hearts all feel really heavy today. It does feel, I have a lot of different, I guess, emotions. Holding this webinar today, there's a part of me that feels a little bit like, why are we doing this today? It feels like maybe we should touch on something else or hold space differently. But, wanted to share that space with you all today, invite you all to engage in this webinar as it feels most meaningful to you. We are talking around normalizing mood changes, so I do think that there's an appropriate fitting to this topic with everything that's been happening as well. But again, just wanted to invite you all to take what feels most helpful for you throughout this webinar, engage as much or as little as you'd like. We will have an opportunity at the end of the webinar to address any questions, concerns, etc. So I invite you all to additionally use that space should you need any additional support. So what I'd like you all to do right now is just to sit back, find a comfortable position. You might like to gently push your feet into the floor, get a sense of the ground beneath you. You're invited to either fix your eyes on a spot. You're welcome to just shut off your video if that feels most meaningful to you. You may sit upright with your back straight and let your shoulders drop. Get a sense of gravity flowing down your spine, anchoring you to the ground, to the floor beneath your feet. And just take a moment to notice what you see. Notice what you can hear. Notice how you are sitting. And notice what you are doing with your hands. Notice the sensations in your nose and mouth. And notice what you are feeling in your body. Notice what you are thinking right now. And take a moment to recognize there's a part of you in there that is able to notice or be aware of everything that you do, everything that you see, hear, touch, taste, smell, think, and feel. For the sake of simplicity, let's call this part of you awareness. And I invite you now to close your eyes or continue to keep them fixed on a spot, whichever you prefer. And bring your awareness to your breathing. For the next few breaths, I'd like you to completely empty your lungs, to push all the air out of them until there's no more left, and then allow them to fill by themselves. Notice how once the lungs are empty, they refill all by themselves. You can take a deep breath in if you want to, but see if you can notice how there's really no need. It just happens by itself. Notice your breath flowing in and out, your chest moving in and moving out. Notice your abdomen rising and falling. And now I'd like for you to reflect on why you came here today. There's something that matters to you, something that is important deep in your heart that motivated you to come here. What is it? Is it about improving your life, personal growth, learning new skills, building better relationships, being a better version of yourself, to treat yourself well? Just do a search inside your heart to clarify why you came here today. And now take a moment to reflect on how you got here today. You didn't magically materialize out of thin air. You had to take action. You had to organize this webinar. You may have had to reschedule things or make time for it amongst all the other important things you have to do. Recognize that right now, you are also taking action. You are sitting here in a chair doing this exercise, not knowing exactly what it involves. You probably have all sorts of thoughts whizzing through your head, all sorts of feelings passing through your body. And yet here you are, sitting in the chair, right here, right now, doing this exercise. And what is it that matters enough to you to bring you here today, to take this action right here and right now, when there are so many other things you could be doing instead? I'd like you to bring your awareness back to your breathing, noticing your breath flowing in and out, your chest moving in and out, and your abdomen rising and falling. I invite you now to undertake a challenge for the next few moments. Your challenge is to keep your attention on your breath, observing it as it flows in and out. And this will be hard because your mind will try to distract you. It will tell you all sorts of stories to try to grab your attention, pulling you away from this moment and what you are doing. And your challenge is to see if you can let those thoughts come and go like passing cars, keeping your attention on your breath, letting your mind chatter away as if it is a radio playing in the background, keeping your attention on your breath. From time to time, your mind will succeed in distracting you. This is normal. This is what minds do. As soon as you realize it, note the distraction Refocus on your breath. As this exercise continues, the feelings and sensations in your body will change. There may be pleasant feelings and sensations showing up, like calmness, peacefulness, contentment. There may be unpleasant ones, like frustration, sadness. You may even notice a backache. See if you can allow those feelings to be exactly as they are in this moment. Don't try to control your feelings, just let them be. Continue focusing on your breathing. This is not a relaxation technique. You are not trying to relax. The aim is to allow yourself to feel whatever you are feeling without a struggle. So if there is an unpleasant feeling present, name it silently. Say to yourself, here's a feeling of sadness, or I notice I'm feeling anxious. Acknowledge it's there and keep your attention on your breathing again and again, bringing your attention back to your breathing. Now expand your awareness, noticing your breath and your body, noticing the position you're at in your chair, where your arms, legs, head, neck, chest, and tummy are placed, and how they may be feeling. Noticing all the sounds around you. Opening your eyes, looking around the room, noticing what you can see. Expand your awareness even further. What can you feel? What can you taste or sense in your nose, in your mouth? And have a stretch now. Noticing yourself stretching. Noticing what you may be thinking right now. Noticing whatever your mind is saying to you about this experience. And taking a moment to realize there's a part of you that notices everything you do, everything you see, hear, touch, taste, smell, think, and feel. And just check in for this moment. This part of you that can notice your thoughts, notice your feelings and your body. Is it good, bad, or is it just there? Thank you very much. And that brings this mindfulness exercise to an end. You're welcome to continue stretching. We'll continue to sort of build off this practice as we're going through. So I also encourage you to continue anchoring with your breath as much as you need to. So hopefully you all are feeling a little bit more grounded, feeling a little bit more connected to how you may be feeling. Trying to stay on brand with this webinar today. So a couple of things that we're going to touch base on today as we normalize mood changes. One is understanding why our mood changes. There's a lot of different, I think, narratives around why our mood changes. I think we also bring our own sort of assumption understanding around what mood changes may mean. Some of them may be true, some of them may be emotion-based. So it may be our own sort of understanding around how we interpret different moods or emotions we're experiencing. So definitely want to spend some time developing that understanding. Second, we'll take a look at factors that influence mood changes. So what may make us vulnerable, whether it's internal, external, or otherwise. And then third, strategies to support mood changes. So we'll use the learnings from understanding and factors to help you develop strategies and start identifying which may be most helpful for you depending on how your mood is fluctuating. And then even for certain emotions, what may feel most effective. Within those, we'll certainly review some of the skills that you learn in the Meru Health 12-week program. We'll also introduce 2 new strategies that aren't part of the program. I know we have a variety in our audience. We have some post-program participants joining, and then I know we also have a couple people from healthcare plans, employer programs. So my goal is to really help or to navigate this webinar to support everyone who's attending. So not only those who have already gone through our program and hope to enhance their learnings, but also to explain a bit around what you can expect from our program and how we sort of discuss and implement some of these strategies. For those who aren't aware of the Meru Health 12-week program, who have not actually gone through the program, we are a 12-week evidence-based program. We are manualized within our 12-week treatment model. So what I mean by that is the 12 weeks are predetermined. They've already been developed. So each of the 12 weeks consists of a different theme. Within that theme, Monday through Friday, we're introducing different videos that provide psychoeducation, skills education, skills application. And we use integrating evidence-based therapy. So cognitive behavioral therapy, we utilize mindfulness, and we also utilize our heart rate variability biofeedback device. Mindfulness and HRV are the 2 common threads throughout all of the 12 weeks. It is pretty independently paced for the participant. So the participant is able to engage as much as it would feel helpful for them. That may be that they're engaging in all the items that week. It may be that they're working with their therapist to identify which would feel most effective for their learning and for their application in alignment with their treatment goals. The role of the Meru Health therapist is to really help coach and guide the participant through the program and be a place of accountability, feedback to enhance their learnings so they can get the most of the program. And then, of course, at the end, I believe I mentioned this earlier, realized I just forgot to mention in our agenda, but we will have time for Q&A at the end. So if you do have any questions, you'll see that Mayu has invited everyone to use a Q&A box within the bottom of your screen to participate or to ask any questions that you may want to get more answers to. All right, so we can dive in. So understanding mood changes. So the first part that I always like to discuss is, sorry, someone just fell. The first part that I always sort of like to discuss whenever we're talking around mood fluctuation, mood changes, is identifying the difference between mood and emotions. We tend to hear mood, emotions, feelings interchangeably. I think that's okay. For the purposes of today, I thought it would be helpful to tease that out a little bit further. So the way that I like to think of mood is that moods essentially inform emotion. So if you think of an umbrella, our mood, for instance, may be depression. And then within that mood, we may experience a range of emotions. So it could be irritability, could be sadness, could be anxiety. But what you'll see on the screen here is a diagram where it discusses the difference between duration, provocation, modulation, expression, and awareness. You guys all have it on your screen, so I'll allow you to read through that. But essentially, we see that moods tend to last longer than emotions. Again, moods inform the emotion. So, and what feelings are, where we're kind of discussing the 3 elements of them. Feelings are essentially the sensation, the physical and mental sensation that one may feel within an emotion. So for instance, something in my environment triggers me. So perhaps it's like the item that just fell off my desk. I'm not sure if you guys heard that bang. Something just fell off my desk here. So perhaps my emotion is worry around what it may be. My emotion is just giving me data into how I'm interpreting what's happening in my environment. So this could be changing moment to moment, right? So I may just have a quick response, worry about what that might be, and I can come back and I can feel calm again as I continue with this webinar. The feeling that I felt when I heard the when I heard the item fall off my desk was I felt a jump in my chest. So I felt a little bit of that nervousness. And what that's doing is it's trying to help me interpret the event that just happened, right? So I feel this way. How am I understanding what that feeling is? I can come back, I feel calm, this feeling dissipated. So I'm able to go back into my overall mood, which my overall mood so far this week has been, I would say, pretty content. I've been in a pretty content mood this week. So you can sort of see how that buildup is. So I hope that makes sense. So again, I would think from macro to micro. So moods, within moods, we may experience different emotions. Those emotions may change. Similarly, I think a good example of this is when you may just sitting doing, whatever it is that you're doing, and you notice a ping of anxiety and you're like, that's weird. Why do I feel anxious? Largely, it's probably something in your environment that you may not even be aware of, just triggered that emotion response, created that sensation, and will eventually resolve within seconds to minutes. All right. So for our next experiential activity, like I shared, there will be a couple. Participate as it feels best for you. I want you to look at this emotion wheel. If you have the link there, if you could please post it into the chat. Otherwise, hopefully you guys can see this. I do have the link at the bottom of the screen as well. Truly, I just Google imaged it. So feel free to log into Google right now too, if that feels most helpful for you. But what I want you guys to do is to take a moment and think about the mindfulness exercise you engaged in. One of the prompts in the mindfulness exercise was to connect with how you're feeling in the moment, what you're noticing, what are your thoughts saying to you, what's bringing you here. And I want you to gather all that data and lean into, just for a moment, how you would describe your mood. If it feels even more helpful, how are you feeling in this moment? What is your emotion in this moment? What you'll see, if it's helpful, if you haven't seen an emotion wheel before, in the center, it's the 6 core emotions. And then you'll see they'll sort of divvy out to provide just additional emotion or mood words to be even more specific. Because sometimes when we say we feel sad, we all have our own interpretation of what that may look like or how it may present. So take a moment. What's showing up for you? Even considering how you feel, or what your thoughts are, or judgments about the emotion you're experiencing. For instance, I'm feeling content and overall calm, but I do notice there's in the background a little bit of feelings of overwhelmed. Like I'd shared in the beginning, I have a lot of sort of mixed feelings today, a little bit of a mixed feeling even coming into this webinar. And so I think there's a part of me too that's feeling a little nervous for how I'll present today. So you can see, again, I have a general mood, different emotions in there. And I'm judging myself a little bit. So those are some of the things about how I may feel. I wish I didn't feel overwhelmed, or you can again see those judgments. How is this going to impact me? Am I going to mess up in the webinar? Some future oriented thinking, future tripping thinking. So we're not going to do anything. I just want you to hold this space. I just want you to get used to identifying. We'll of course come back to it for those who are guessing. So why is it important to understand mood changes? So there's a couple points that I want to make sure that we touch base on. First and foremost, moods are a natural process of the human experience. They're very evolutionary. They've existed as long as humans existed, as they help us to inform action, motivation. They're a big aspect in how we filter out our conscious versus unconscious processes. So why certain things are brought into our awareness versus why some things aren't. They guide social behavior. We'll go into in just a little bit. We're actually going to tease out what specific emotions, what their evolutionary purpose is. But I think this is, first and foremost, just to validate that it's natural. We should not feel happy all the time. We should not feel sad all the time. We want that range in mood. We want to see some fluctuation. Now, we don't want it, every single day that you're up and down, up and down, up and down. But we should see some fluctuation in mood, right? And it should be hopefully congruent to the situation we're going through. And that's really meant to protect us and to help us navigate various situations. Fluctuation in our mood, again, is normal. It's not a straight line. So I think one big misconception that we see is that, or hear, is that, I'm making progress, and oops, something happened and I dipped a little bit. That's okay. Again, what we're trying to see is, one, we want to see more of that fluctuation. So if you think of a wave, the term that I heard years ago that I still stick with today is there should be an emotional rhythm. So for those who enjoy music, sort of align with that, right? That all of our life has a melody. Essentially, you could relate our mood to a melody, but that we should see, again, that we shouldn't see a straight line. It's not realistic. And so if you happen to see progress and then you dip a little, go back up, dip a little, that's absolutely okay. A fun fact. So the Queen's University did a study, and what they found, and this was back in 2020, so just 2 years ago, likely even a little bit less, a year and a half, I believe it was. They found that the average young adult human has about 6,000 thoughts a day. I think the exact was around 6,200, give or take. But we are not aware of all of them. You may have heard previously, there's a lot of conversation in the field, or a belief in the field, that we were having. I've heard anywhere from 50,000 thoughts, 60,000 thoughts, 100,000 thoughts. What they did in this study that came down to a smaller number was they basically looked at what's called thought worms. And what those thought worms are essentially is, if I have this thought, what thought is it leading into the next, into the next, into the next? And so they viewed thoughts in a little bit of a different context, and not so individualized, if you will, but essentially looked at the process more. I do have this study linked. I believe I have it either at the end, and I believe it's linked right here as well. So if you're interested, you can look that up. But again, if we're mindful that we have this many thoughts a day, could it make sense that we don't see as much of a straight line, right? Again, our unconscious awareness will sort of take on those thoughts, and they filter our thoughts out depending on how we've associated with them. So if you've participated in the Meru Health program, you hear a lot of discussion around how we're developing neural pathways, and it can take 6 to 8 weeks to develop these neural pathways and change the associations we may have with certain stimuli within our environment. And this is speaking exactly to it, right? If I'm just working at home in my office, I probably don't need to be aware of something that happened in the ocean, right? It could be something that popped up on my screen, but if I'm at work, it's not really relevant to what I'm doing right now, so I don't have to know it. My unconscious process won't even necessarily tune into that. It may just flag it, keep it moving. So that's, I think, meaningful when we think of our mood. Sometimes it makes sense, sometimes it doesn't. Avoidance or discomfort of mood fluctuation typically lead to problematic behaviors. So this is very common. The majority of people who reach out for therapy services, whether it's at Meru, or if you seek support elsewhere, what we typically are assessing is what is contributing to this mood fluctuation. Partly, right, we're looking not only at the cognitive, biological, et cetera, pieces of it, but how is the individual perhaps reinforcing it through problematic behaviors. And this typically is avoidance. So there's a saying in mental health or in therapy where we say pain is inevitable, suffering is pain we're not willing to have. So what are we doing to actively try to get away from something that is creating discomfort in our life? And is it actually effective to do so? The other piece is understanding your unique mood patterns will support you in increasing psychological flexibility and acceptance, and get your needs met more readily. So with this, there's a lot of comparison that we see. I think as humans, it's natural to do it. I think we compare ourselves towards others who are going through related experiences. We compare ourselves with our social connections, with work, so on and so forth. We're all very different. We all have very different things that will trigger and factor into why our mood is the way it is. And we all have different needs that need to get met. So it's more important not to just take a look and compare ourselves to others, but really to understand our own unique mood patterns. All right, and finally, it will also inform what you may need in that moment and support decision-making. So what that looks like is, like I mentioned in the beginning, there's an evolutionary purpose to our mood. So for instance, when we feel fear or any of those emotions that branch out from it, it's communicating to us that there's a real or perceived threat. Irritable, real or perceived attack, sadness, loss, shame, rejection, happy, connection. There's real or perceived connection. So sometimes when you notice those moods coming up or those emotions coming up and you're not quite sure, typically that there's some stimuli in the environment that's just bringing your attention to it. Doesn't mean it's true. It's just saying that there's perhaps at one point something that got associated to say, hey, this may create some feelings of nervousness or anxiety or fearfulness in your life. Check it out, and you can either act on it or you can let it go. Typically, when we feel something, again, we take it to be true. And so that's where it's really important. If we can understand why we're feeling certain things or what it may be sharing with us, it can give a little bit more context instead of us just reacting to it. Thoughts are not facts. Emotions are not facts. They're simply sources of information. One of my favorite mantras is emotions and thoughts are not good or bad. They just are. Again, they're just sources of information. We can do with it whatever feels most effective in that moment. So workplace examples. So we do see a lot of individuals with symptoms of burnout presenting to Meru Health. So some of the emotions that come up for people when they're sharing that they're feeling burned out at work or they're not feeling connected to work, anxious, angry, and then of course we can feel happy and connected in our role as well. So typically if you're feeling anxious in the workplace, it's usually indicating you're not feeling aligned with the work that you're doing. You're feeling a lack of balance in your day-to-day. It could even be that you're not feeling connected or not socially safe. Anger could be you're feeling unappreciated. There could be a lack of communication, so on and so forth. Again, we all have our own unique relationship with our emotions. These may be reversed for you, so please don't take these as hard facts or just examples. And our goal is to be happy. We want to feel connected. We want to feel accepted, understood, aligned, socially connected, safe within our work environment. So what I want you all to do, if you're willing, is just to think about with work, if you're noticing those feelings of burnout, or when you think about your job in general. Some of you may even be at work right now as we speak. If you even think back to the emotion wheel exercise we did, how do you feel when you think about work? How do you feel after you leave work, heading into work? And just spend a couple moments taking a look at what that emotion is and what it may be communicating to you that you need. You are also welcome to share that in the chat as well. Again, we do have quite a large audience today, so I think everyone always responds well when people are being able to relate to each other. I know for me, certain weeks at work, or depending on what I'm doing at work, I can feel all of these within a week. I can feel really happy and excited, and then I pop into the next task and I feel frustrated, or I feel uncertain or insecure in my work. Sometimes I feel really confident in my work too. All right. Factors that influence mood changes. So there's a lot. Essentially, this is my version of saying everything influences mood change. Internally, externally, environmentally, culturally. Again, there's a wide variety of things that influence our mood. We're going to touch base on these. What I want to be very, set the intention or expectation for. We're going to lightly touch on a lot of things. If there's anything that is of interest or that's resonating with you that you'd like to learn more about, you're welcome to let us know that, and we're happy to provide additional resources. because again, there's a lot of factors. And what I always want to emphasize is we want to make it very unique to yourself, for you to understand what's contributing to your experience within emotion. So first and foremost, I don't think that this is going to necessarily shock anyone, but sleep. And I have all of these references at the end of the slide too. So again, if you want to learn more about it, if you want to look at this specific study or journal, you're welcome to. But healthy sleep repairs adaptive processing, functional brain activity, integrity of the medial prefrontal cortex, amygdala connections, and thus improves the capacity to regulate emotions as well as individuals' well-being. So my interpretation of that, because that is a lot of medical jargon, is the better we sleep, the better we feel. So we know in the stages of sleep, so there's non-REM sleep and REM sleep. You may know stages 1 through 4, right? And then REM sleep. Both of those are really important and work together for emotional regulation. It's our emotional processing time, and for our motivational drive processes. So these get fulfilled during those stages of sleep, again, REM and non-REM sleep. What they found was people who don't sleep effectively or receive poor sleep. I think the statistic, and this is not referenced in this study, I'm sort of speaking just from my own knowledge, so forgive me for not having the reference. I believe it's upwards of like 50 to 60%. We'll see a 50 or 60% increase in how our amygdala is responding. Our amygdala is basically our center that's part of the reptilian brain. We're actually going to dive into that in a little bit, so I just want you to take a note of that. But yeah, it's basically, this is where we're really going to sort of react to things. When people say like, oh, they flip their lid, it's because their amygdala is highly activated. So we are not overly effective in this moment, except for survival purposes. So sleep is really important. There's a lot of hormones, right? Cortisol, for instance, that gets released during sleep. And so this is a really important time for us to regulate. We do see a lot of sort of bi-directional influence between if we get poor sleep, it will negatively impact mood, and vice versa. If someone is presenting with symptoms of depression, for instance, we tend to see disruption in sleep. That's because sleep, nutrition, and mood all regulate off of each other. Again, think of the hormones. And that leads us into nutrition, right? So we know food metabolizes form chemicals like serotonin and dopamine. These are building blocks for brain health and key players for happiness. 95% of our serotonin is produced in our gut. And so essentially, if we are not engaging in proper nutrition, and that this is not intended to tell people what to eat, how to eat. I'm not encouraging to go on a diet all of a sudden, but just be mindful of the role nutrition plays. If you know that you have a vulnerability, or even, for instance, if I get really busy in a meeting and I forget to eat or I skip my lunch, I know like I'm getting hangry or I'm not as focused. I feel more foggy. So I have to be mindful to take my breaks and to eat appropriately. Similarly, if I overeat, I don't really want to do anything. I'm likely going to like Netflix and Hulu, honestly, and popcorn's my vice. So I may just sit there and just keep eating and eating. And then my motivation may shift a little bit. The other important part, I think, to hear about this is, we're looking, there's a lot of new conversations in the field between the gut-brain relationship. Nutritional psychiatry is a big topic right now as well. Our GI tract is aligned with nerves. And this, when there's proper nutrients, creating good bacteria, we can actually see a reduction in inflammation or a support towards reducing inflammation. So we know that good bacteria can help, and serotonin can help inhibit inflammation in the body as well, which is interesting. All right, life transitions and significant life events. So I always say what works in what context. So this may be informed by how we view others, ourselves, and the world around us. It's our interpretation of events or environments. Perspective is everything, right? If I feel, let's say I get feedback from one of my bosses about this webinar, I can leave there and say, oh, that was a really good conversation. Oh, that was bad. I might get fired. They're judging me for how I work. How I interpret a situation will largely impact our mood, right? Let's say I get constructive feedback on a project that I worked on. I can view that as like, wow, they're really invested in helping me, or I can look at it as, well, they really think I'm doing a bad job. It's all around how, again, I'm perceiving the environment, right, wrong, good, bad, safety, danger. And then this feeds into our thoughts, and then consequently feeds into our behaviors. This is the whole premise behind cognitive behavioral therapy. And then finally, biology. So we know, right, that biologically, if we have a predisposition or vulnerability, right, to an imbalance, let's say a hormone imbalance, issues with our immune system, endocrine, et cetera, there could be a direct correlation to any changes in our mood that we see. A lot of the diagnoses that we see, a lot of the disruption to the mood process, thyroid, B12 deficiency, depression, diabetes, there's a correlation between cancer, heart disease, infections, even there's things like post-surgery depression, PMDD, PCOS, right? So on and so forth. And I think what's really important, and even seasons and weather. So these are factors that are outside of our control, right? Like the weather changes, we're not producing, or we're overproducing melatonin. We're not getting enough of certain vitamins or the production of hormones that we may in different seasons. So if you have any concerns, let's say you've been in therapy, you're doing everything you can, something's just getting in the way, and you have concerns that either a current medical diagnosis or that you may be at risk or another one could be in play, don't hesitate to go get that checked. Sometimes what we think is a primary mental health symptom or cause may be due to it being a symptom of something more medical. So again, like I said, lots of different things that can impact our mood. I think that's a lot to digest, but just see if any of that really resonates with you. And largely, a lot of these things are just small changes you can make. Making sure, again, you don't skip lunch, get that meal, see how that impacts your day. Change your sleep routine. If you're someone who's like, I don't really need to sleep a lot, I'd rather stay up, or I'd rather get up early and do these things, see if an extra hour can even do you some good. All right, strategies. And I'm being mindful of time as well for questions. So a lot of these will likely be familiar to you. When we look at strategies to support our mood changes, there's a couple key things that we want to hit. One, we want you to, again, learn your vulnerabilities and develop a plan. So we call this developing a cope ahead plan. So what works in what context? Moods, again, if you think of emotional rhythm, if you think of them as a wave, what we may want to do proactively is maybe not what we want to do during the emotion, and perhaps what we may not need after we just got through a difficult emotions. We'll talk around that in just, I believe, in the next slide or two. And taking a look at the things like what help if you have certain vulnerabilities, like let's say it's winter, how are you supporting that vulnerability through the engagement in different hobbies, or even developing even stronger connection. Therapy, for instance, Meru Health, of course I'll plug, but cognitive behavioral interventions, behavior modification, mindfulness, and heart rate variability. Biofeedback is a really great tool. Even mindfulness and HRVB are really great standalones. And medication management. So again, if you know that there's a biological vulnerability, a medical vulnerability, you may want to seek some medication support or get an assessment. All right, so these are our happy hormones. Again, I have the link down here if you're interested in looking at this diagram, but essentially what we're trying to do to regulate mood and to maintain more of a happy, calm, connected mood is to be sure that you're engaging in the activities and doing the things that you need to do for dose. So dopamine, oxytocin, serotonin, and endorphins. Now, an interesting fact, and I believe it mentions it down here as well, but dopamine and endorphin are short-lived. So that's something to keep in mind. I have people who will go exercise and they're like, I feel great after, but then they're questioning why it hasn't sustained. Well, if you only exercise once a week, it likely is not going to sustain throughout the week, versus oxytocin, serotonin tend to be longer lived. So this is a good breakdown. Again, I won't spend too much time here just with respect to time, but then gives a couple ideas of how you can get more of that hormone. So this is a wave you've probably seen me doing. And this is just a good diagram I want you all to take a look at as you're thinking around how do I support myself through these mood fluctuations. Again, you want a variety in your toolbox. Mindfulness I may be using throughout all of this. Self-compassion, for instance, is really helpful. These are all good building blocks, I think, to maintaining our mood and good preventative skills that we can just implement in our day-to-day, just like good sleep, good nutrition. But during the emotion, we may have to use a different set of skills because you're in a different mindset where your mind is in a different place. So I had mentioned before about the amygdala. So what I invite everyone to do is make a fist. So when you put your thumb up like you're holding the number 4, or sorry, your thumb in like you're holding the number 4, and tuck that over. This is the hand-brain metaphor. I also have a link to this, so don't worry if you don't get it in the first go. But this is essentially a model of the brain, right? So this is our brainstem, and this is our amygdala, right? So brainstem, amygdala. This is our reptilian brain. Our reptilian brain, again, the goal of it is for evolutionary needs, shelter, food, procreation, emotional processing. What largely happens, right, where we want to be when we're fully regulated is in our mammalian brain. So this is our cerebellum. This would represent our cerebrum, prefrontal cortex. Yeah, and all of these are essential for balance, for thinking and speaking, smart decision making, happy and productive. Now, I get triggered in my environment. Again, this is the term flip the lid you all may have heard throughout your lifetime, is when we literally flip. And so we move into our reptilian brain. This is why it's really difficult at times to think things through, to make proper decisions, and why we may act more impulsive. So we may get triggered, and again, we flip our lid. And what happens is over time, the regulation process through using these different skills will start coming back down. Now, I'm regulating, I get triggered again, back up. So this is what happens in trauma, is that people will typically be in their mammalian brain, trigger in the environment, trauma ensues, and we're up. Now, what can happen is if we're not able to fully regulate, this is how we're functioning. We may be in a state of hyperarousal or even hypoarousal. So you want to make sure that you're doing the proper things to be able to fully regulate and maintain back in that stage of regulation. And this is where recovery is really important, because I may be able to get back down, but if I keep getting triggered, I'm just staying up. So we want to make sure too that we're nurturing ourselves appropriately and engaging in skills that will support us throughout these different emotional processes. So a lot of words on here. These are basically the skills that you may have learned, or for those who are joining from healthcare plans and EAP plans. These are the skills that we emphasize in addition to others, but that would align with sort of this emotional wave. So I kind of broke this down just for reference. So everyday mindfulness, nutrition, grounding, so on and so forth, just as a refresher, if you want to go back into the practice library and refresh yourself, here are some skills that would be recommended. 2 skills that I'm going to quickly go through. So cognitive diffusion is a really great one. We did a lot of this in our mindfulness exercise. The cognitive diffusion is teaching us to basically deliteralize our experience. So we want to change how we're associating with a given stimuli, whether it's a thought, a feeling, etc. So for instance, I may notice, like if I look at this word irritable and I'm feeling irritable right now, I may even feel myself getting even more worked up, right? I have an association towards what irritability is. Maybe it means I have a memory of someone who used to get irritable, used to yell and scream. So this is really intimidating to me, but I may notice some memories coming up. So I want you to think about what shows up in your mind when you look at this word, when you look at this word, and then when you look at this word. So you may notice you have different experiences. They are all the same thing. This is just irritable scrambled, and this is irritable and finished. So actually, when I look at this word, I laugh because when I was thinking of the webinar, I was like, there's no way I'm going to be able to pronounce that. And I just think, I don't know, it just makes me laugh. Because I've tried it too many times and it's a disaster. But I have a very different experience looking at this word versus this word. So that's just an example of how cognitive diffusion can change our belief and change the association we have. These are two other experiments. With respect to time, we won't be able to necessarily go through each of them. But what it essentially is doing is having you, again, change the context. So for example, if I think of the word, if we use the word sad, for instance, right? I'm feeling sad. If I say it fast or really slow, you'll notice that there's a difference. So let's go ahead and do that now. So I want everyone to say sad as fast as you can for 10 seconds. Ready? Go. Sad, 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 sad. Okay. What did you notice? Maybe it was like how it felt in your body. For me, I kept feeling like, I don't know, the word salsa kept coming up in my mind, like salsa, salsa, I don't know. I feel like if I kept going, it would have shimmied a little bit, but I had a very different experience than if I just said sad, sad, sad. So these are great ways to practice cognitive diffusion. Similarly, instead of saying I'm sad and identifying in that emotion, saying I notice I feel sad. It changes how our brain processes the event. And so it's not, hi, I'm Lindsay, hi, I'm sad. It's just, I'm feeling sad. It's just noting one of many experiences you're having. The other skill is opposite action. So this is essentially a skill to use when the emotions or the intensity of what you're feeling do not fit the facts. So for example, let's say I feel anxious about work. I'm anticipating going into work. I just feel really anxious. There's nothing really that's happening where I have to, maybe I'm just anxious about going. Maybe my urge is to avoid, right? I'm just going to call out, I'm going to avoid real or perceived threat, don't approach, right? I'm just going to avoid. If I evaluate that, that's not actually needed to do, and it's not effective. I can't predict the future. And I'm really just assuming, right? I'm just uncomfortable. There's not a reason I actually have to avoid and not approach. So perhaps I go into work and I just bump into my boss and I just let her know, hey, just feeling a little off today, just feeling a little anxious. So this is acting opposite to what our emotions may be encouraging us to do if it's not effective to do, or if it's not needed to do. So cognitive diffusion is all about being in the experience, and opposite action is more of a doing. All right, so mood fluctuations, we've talked around it, right? We all can kind of anticipate that we'll continue to see mood fluctuations. Oftentimes we get asked, well, when should I reach out? So this is where if you see a negative change in your mood presentation that's lasting an extended duration of time, so longer than normal, than what your typical pattern is. There's new or worsening symptoms that you're seeing, whether it's mental health, physical health, or otherwise. If that's something, if you're seeing something new, something worsening, and you're concerned, just ask and reach out for support. Certainly if it's causing a disruption, or if you notice any significant changes in your behavior, you're noticing you're having a lot of difficulty regulating, we definitely want you to just ask for help. And when in doubt, do it. That's what we're here for. If you have not gone through the Meru Health 12-week program and you're interested or want to learn more about us, here's the information to do so. If you have gone through the Meru Health program and want to and are interested in perhaps going through it again with therapist support, please feel free to reach out to us as well, and we're happy to see if that's an option for you. All right, so now we'll bring it to questions. Mayu, I think there you are.
Hello. Thank you so much, Lindsay. What a beautiful webinar so far. We have a few minutes for questions.
Sure.
Right now, I don't see any questions in the Q&A box, but if somebody has something on their mind, I would love to hear those. Now it's your chance to ask Lindsay whatever is on your mind about moods. I actually have one question that I'd love to ask, which is, when do you know that the situation that is causing, for example, anxiety, and you're practicing to manage your emotions and your moods, but when do you know that you should actually change the situation? Like when should you change a work, a relationship, and
Mhm.
when should you just learn how to manage those emotions yourself?
Yeah, so that's a really good question. I would say, I think it's largely how it's interfering in your life, right? I think, and that's kind of a vague answer, but I would say if you feel like you're having a response in a way that's interfering with your ability to move forward as in the way that you'd like, and it's especially if it's recurring, I think that's something to examine. Now, just because something is triggering us, that doesn't mean we have to cut it out of our life, right? But I think it's taking a look at how you're interpreting it and what's your willingness, I think, to do something different. Sometimes too it could be that at work there's maybe someone that you're working with that's just really frustrating, and you're not sure if you can continue working with that individual, and you're considering going to your boss. Again, what is the risk in that? Is this something, what are you willing to do? Are you willing to sit down and have a conversation with them? Do you feel like it's effective for you to do so? I think largely one question that I always encourage my participants or even my clients to ask is, what in this is mine and what is theirs, right? Is this something that has to do with the external factor, whether it's a person, a situation, otherwise, or is this something that's mine? Like, am I going to someone else or to something else to try to fix something that really is I have ownership over? Does that make sense? Is that helpful?
Makes total sense.
Yeah.
Thank you.
Yeah.
If there are no other questions, final call. Um, we will share the recording
Mm-hmm.
with everybody in the follow-up email and alongside with all the resources that Lindsay has shared in the presentation today. And on my behalf and from Meru Health's behalf, thank you so much, everyone, for participating today.
Yeah, thank you all so much. I know I went through that pretty quickly. So if you do have any questions that pop up after reviewing the material, feel free to let us know. We do have in the PowerPoint, I did add a whole page of different resources for you to learn more about the skills and all of that. So thank you so much.